Welcome to Raaonline. So what is peptic ulcer? What is this peptic ulcer disease? The commonly used symptoms, gastritis is the symptom commonly we mention. So irritation of the gastric mucosa is the first step, starting step of this peptic ulcer. Peptic ulcer is the imbalance between aggressive as well as defensive factor which occurs in our gastric mucosa. So in our gastric mucosa, acid is secreted which is useful for the digestion of our food, all the substances. This secretion of HCl is very important. And if the HCl is secreted in the empty stomach without having the food content, what will happen? It will irritate, erode the gastric mucosa and produces lesions. So that type of lesions, that if it occurs in the stomach, it is called as stomach ulcer. If it occurs in the duodenum, it is called as duodenal ulcer. And if it is in esophagus, then it is esophageal ulcer, otherwise called as GERD, gastric esophageal reflux disease. So the imbalance between the aggressive as well as defensive factors. The aggressive factors, which are very essential for the normal digestion of food as well as medicines, whatever substance we are taking, these are the factors which are secreted in our gastric mucosa. Acid, pepsin, bile, NSAID, alcohol, these are the substances which produces the peptic ulcer. This H. pylori, NSAID and alcohol are the substances which are the substances which we are taking outside, which increases this acid, pepsin and bile. These are the aggressive factors. The defensive factors comes mucus, bicarbonate secretion, prostaglandins which are secreted in our gastric mucosa, the blood flow to the stomach and common constitution of our body and free radical scavenger. So that means antioxidants. These are the defensive factors which avoid or which nullify the effects of this aggressive factor. If the imbalance occurs, means that leads to a condition called peptic ulcer, otherwise called as duodenal ulcer, if it occurs in the duodenum. Commonly in this peptic ulcer, a lesion more than 0.5 mm if it is seen in the gastric mucosa and associated with severe gastritis, vomiting, reflux disease, gastric esophageal reflux disease. So that condition is named as peptic ulcer. So why this peptic ulcer occur? What are the reasons? So how this HCl, this is acid which is secreted in our stomach, is secreted. What are the receptors important for this acid secretion? So consider this is, you might be knowing, parietal cells which are present in our stomach, that is responsible for the secretion of this HCl. So this is lumen, this is apical membrane of the parietal cell and this is basolateral membrane, that is underlying factor of this parietal cells. And these are the substances, these three are the main culprits which secretes this H plus ions. So histamine. Histamine, especially H2 histamines. So you might be knowing H1 histamines are mainly responsible for allergic reactions, and this histamines, H2 histamines which are secreted, which releases H plus ions, and cholinergic innervation through M3 receptors, it increases the H plus ion productions, and gastrin which is secreted through these CCK2 receptors, that is also responsible for increased calcium production as well as increased acid production. So these are the three important things which is responsible for the production of acid. That means the main part of acid, that is H plus ions, are produced by these conditions. So after this, through an enzyme called H plus K plus ATPase, the HCl production is taking place. In the following slides, we will see how this HCl production takes place.